All right, again, thank you very much for joining us today for our Discover Macomb event, highlighting our health and human services. My name is Terry Pagano. I'm in the admissions office. I'm an outreach coordinator, and I just want to go over quickly with you our agenda tonight. We're going to talk about why choose Macomb. We're going to do an overview of the Health and Human Services program, and we have a great video for you tonight. At the end, we'll be doing a question and answer session. So I encourage you, as we're going through the event, if you have any questions, we have our chat open. So feel free to go into the chat and type your questions in. We may be answering them throughout the session. If not, we'll be going through those questions and at the end and make sure we answer everything for you. And then we're going to be doing a little wrap up and talk a little bit about your next steps. Macomb has over 200 programs. We have very large labs for our programs. So as part of our health program, they have a full building that is dedicated to our health programs. So this is why some of our programs have to be housed at different campuses. Because of the large labs, and you'll be seeing some slides and in the video what exactly is housed at our center campus for our health programs. Our South Campus in Warren, you'll see the list of programs that are there, but we want to let you know that if you're just starting off with your general education programs or continuing ed, that will be at both campuses, South and Center. Our East Campus in Clinton Township will house our police and fire, and the MTech is for employees to send, their employers to send their employees for retraining. So you can see some of the pictures below how very interactive our classrooms are. Part of the admission steps is talking to a counselor, and you're going to be talking to them about choosing a pathway. So if you're interested in the health program, you might not know which area you want to go into, but you know you want to go into health. So you'll be discussing that with one of our Macomb counselors. We do have some upcoming admissions and outreach events. So this would be basic information for students. So please take a look at these. There's a financial aid, how to register. There's a QR code right there. So if you would like to take a picture of that, or you can also go to our website and view all of our upcoming events. So we're going to watch a quick video, and then I would like to introduce Andrea Shaw, Associate Dean of Health and Human Services. So sit back and enjoy the quick little video.
When the unthinkable happens, and you have to trust your life to someone else, there's a good chance the people helping you were trained at Macomb Community College. From first responders like police officers and firefighters, to the emergency medical professionals who can transport you to safety. Macomb's health and public service programs educate those who keep the community protected and healthy. Interdisciplinary care is provided by a team of nurses, respiratory therapists, and surgical technologists who come together to make the difference in critical situations. Macomb graduates, like those from our medical assistant program, work with you and your physician through a full recovery and healthy life. We produce physical and occupational therapy assistants and fitness trainers who help you find optimal health. We also train veterinary technicians who care for the animals that care for you. And Macomb's early childhood education program trains professionals who provide a solid foundation for your child's education. While you recover, our health information technologists process your medical records and insurance claims, and our pharmacy technicians ensure that appropriate medications are dispensed to you safely. When the unthinkable happens, Macomb graduates are thinking about getting you the best care. Macomb Community College. We're everywhere you need us to be.
Well, hello everyone. I'm Andrea Shaw. I'm the Associate Dean of Health and Human Services at Macomb Community College, and I'm very happy to be with you here tonight. As we heard already, there are several programs in health at Macomb Community College, and this slide itself depicts about 13 of them. What's very unique about this slide is it goes into every area of health, whether you're caring for a patient or an animal that Macomb has. Caring for a patient or an animal starts with wellness. So all of our health programs are very focused on wellness, poor health prevention, good health promotion, and each of the programs will focus on that. It's not just about taking care of a sick patient or a sick animal. There's a lot of education, a lot of learning that goes into all of our programs, and we're very excited to be able to talk. We could talk for hours about each of our programs, but we're just going to give you a little ditty tonight and have you reach out to us for more questions later. So this is the start of our health degree programs on this slide right here. Something that we pride ourselves in at Macomb Community College is state-of-the-art facilities and equipment. And what does that mean to you? Well, what it means to us is two different things. It's impossible for us to teach you what is new and evidence-based and best practices without updated equipment. So what we have on our campus is technology and knowledge combined that give you a real life experience. So you're learning in a setting that mimics the community setting that you're actually going to be working in very closely. So in this slide alone, you can see on the far right, there's some dental equipment, and that's in our dental program at the South Campus. At the top, we also have an operating room, another slide over, some more virtual simulation that you can use to learn on the dental equipment. And at the bottom, it's an anatomage table, which gives you a nice three-dimensional sagittal view of some of the pictures and how another way for you to learn. So we try to help you in very many different ways, but get you where the world is going with all your knowledge and technology. The program options are abundant, as I mentioned from 2 slides ago, and many of them are depicted because we listen to our community. Our community tells us what programs are needed, what do we need to be teaching and educating to keep our community and the surrounding communities healthy, well, and get in a nice area to live in. So all of our programs here, and you can see, what does nursing have to do with these little kids on the ground? Well, it's everything, because we teach you how to care for people, babies and adults all alike in different health settings. So it's a very strong educational background, and it shows you how abundant and robust the programs at Macomb really are. So you can go into many different areas, and we'll teach you how to competently and safely care for the patients in every area. The opportunities that we're talking about are, again, in great demand. We do much research in areas looking to see the high demand jobs, what is the highest paying, what is lowest paying, what is needed in our community. And we look to see the technologies I mentioned before and bring that to the college so that we're giving the community a very well-rounded opportunity to learn and to grow. We really want to keep our community. Macomb County is a very large county, and we do service. People do move out of the county and take care of patients in other areas, but we can definitely serve Macomb County proudly with the robust amount of programs that we have at the college. As you can see in the slide, we would teach you physical and occupational therapy. Respiratory therapy is on there. You can see how we demonstrate and show you how to do safe movements, care for your patients. And safety is at the utmost of our concern with all of our education, making sure you learn not just the right stuff, but the right way to do all the techniques so that you are very safe, your patients are safe, and you're very valued in your position. Paula, I'd like to introduce Paula Primo. She's the Associate Dean, my counterpart in Macomb Community College.
Good evening, everyone. Thank you so much for joining us tonight. One thing that we pride ourselves on at Macomb is all of our 4-credit health programs are nationally accredited. And what this means is we teach to the national accreditation standards, which this ensures that we educate our students using the highest practice standards for those particular programs, which ensures our students' success as they move along in their careers and their program of study. Here we have our pass rates for our certification licensures. You can see that we have a very successful and robust pass rate here at Macomb Community College. We do keep a close eye on these particular pass rates. Our students' success is our success. So when we do find something that tends to fall a little bit lower, we do our research on that and our due diligence. We work with the accreditor and we make sure that we get those pass rates up where we would like them to be so that they remain there. Of course, some of these statistics here are a little askew according to the pandemic that we've went through when these were recorded. And I suspect when we have our 2021 results, they will continue to be even higher in some of the areas. So for our Associate of Applied Science at Macomb, we have 2-year programs. One of the exceptions to the 2-year program is our medical assisting certificate, which is 2 semesters. So a student could start the medical assistant certificate program in August, and they would complete that in May. That does not include the 3 prerequisite courses for the class, which can be taken the semester before you begin, which would be in the summer, or you could take them in the fall to begin your certificate in the winter. The credit hours for our associate degree programs average between 62 and 73 total credits. For fall semester starts, there are some exceptions where nursing, medical assistant, and our early childhood programs, you can enter those programs at fall or winter semester. Another nice thing that Macomb does that really strengthens our program is all of our programs have fieldwork practicum experiences. And that gives the student the real world training and hands-on that you will see when you work in that particular occupation. It definitely enriches the student experience, and it gives you a chance to apply the knowledge that you learn in your coursework and actually apply it in the medical setting. So that is one strength that we do have at Macomb. So all of our programs can be taken full-time or are full-time, except for our early childhood education. And the early childhood education program can be taken part-time. A lot of the people who are students who come into the early childhood program actually work in daycare centers. So attending the program on a part-time basis is much better for those individuals. Most, but not all, are day classes. We do have some night courses. And the nice, unique thing that helps to work around your schedule with working and home life is that some of the classes are offered online and in hybrid formats, which makes it much more convenient for anything outside of the program that you may have going on. Another great strength of Macomb Community College is our University Center. We have articulation agreements with several Michigan colleges and universities for our credits to transfer. A sample of those would be Central Michigan University, Michigan State University, Ferris State University, Madonna, and many, many more. So the credits and the time that you spend at Macomb can transfer into higher advancing degrees at any time that you would like to pursue those.
I'm going to talk for a moment about selective admissions. So some of the programs at Macomb Community College are selective admissions, which means that there is not a walk-in program. You must apply. And every program that's on here, all the way down in the left margin of the slide, is a selective admission program. Each selective admission program does have its own prerequisites. So it's important that when the students are looking into the programs, an individual program, they do take note of some of the individual prereqs. Some of the classes are different. Some of the ranking is different. It might be ranked on different GPAs or a different percentage of GPA versus T-score, which I'll talk about in a second. So one of the things that we really want to stress is taking note of that. Some students will oftentimes apply for more than one program. Maybe they're just passionate about health, and they say, well, I'm going to apply to nursing and to dental hygiene and OTA and PTA, but they don't take note of the differences between the programs. So they have to do that to make sure that their packet is thoroughly complete when they go to submission. The requirements are always listed they're actually on our website. You can actually go to our website and type in selective admissions, and each of in our website, they'll show you a little video of each program and an individual selective admission packet, which sounds big. Packet sounds big. It's only 2 pages. And it's just so the crucial information that a student or an applicant would need to know, or an advisor. Some of the prerequisites that they're referring to are, some of your sciences, your micro, your different biologies, English. So those are important to take note. Also, the grade point average. One thing I want to point out about the grade point average is some of the grade point averages that they're looking for are in some of your core classes, your English, your math, things like that. But at the college, it's important to know that those prerequisites typically are a C. They take it up to maybe a D for passing, but when that course comes under the ranking for a selective admission program, they all must be passed with a C or better. And I'm really bringing that home here because I'm hoping a lot of advisors are here and they can communicate that to their student. It's do the best you can in all these classes. Last one is the ATITs testing. ATITs is a test that we use for ranking and all of our programs that are on this slide here, except for surgical technology does not use the TEAS test. And what this test does is picks up on math, English, science, and grammar. These are topics that the students are learning in high school, first level college, and there's even a study manual that we can give to the students, or they can purchase, and there's some resources they can use to study. We really, really, really stress that students study for this, that they don't just walk on and take it, because we do only permit that to be taken once in an admission cycle or an academic cycle. And so if they take it and they didn't score very well, that's the score that we have to use for that whole admission cycle. They can use a score for up to 3 years, however, if they do well, but it's just not good enough compared to what their counterparts are scoring, then they can take it again every year, and we can use the score for 3 years, and we'll pick the highest score. And there's more information on our website about that. Deadlines is very important. February 1st is our deadline every year for all the admissions information to be submitted. And it's important, again, that the students are very cognizant about knowing all the data so that their packet is thoroughly complete. And I love that they have advising and counseling's number on here. We stress a lot of communication and a lot of monitoring of their information, so to make sure that everything that they need does get in a timely fashion. One of the programs that's we found a spot to put it in the program is an opportunity for a ladder. So a ladder program gives a student an ability to start with one program, stop after they take it, and go off, make a career out of that. And one of the examples is our central processing distribution technician program, which is also known as like a sterile processor. They can come in, this is offered 2 times a year. They can take it in the fall or they can take it in the winter. And then they can, like I said, they can get their certificate and they'll be on their way and be very successful and have a good career of that. If they want to pursue a different type or a more robust program in the operating room, they can apply through the selective admissions, but they don't need the TEAS test. Then I correct myself on that. And they can go into the surgical technology program. And that is a full 2-semester program on top of the CPDT program. So they can stop, go get certified and live happily ever after, or they can go into this program, apply, get in and have another year and embellish their whole world in the OR. It's a whole new different world for them. So it's a nice little ladder program that we have for them. So one of the words that I used a few slides back was choice. And we have to this is a real showstopper slide. We have to kind of go big on this because this is a very important component to the presentation. Students are going to be given so much information tonight, and to sit there maybe with their families or their spouses and try to consider what should they go into, what should they ask more questions about. But one thing I have to bring forward is a criminal background check, drug screen, and immunizations. A lot of the students that are going into the programs are coming out of high school. This is a very exciting time of the year for them, they're going to be graduating, or they're considering, they're maybe a year from graduating, and they want to have fun. Unfortunately, sometimes the fun can lead to problems such as drinking, driving, drugs, things like that. And I don't want to be Debbie Downer here on this slide, but I want to bring it home that it's very important that the applicant consider and continue to make very smart choices in their life to be successful in their career, because any criminal background check or markers on their criminal background screen can actually delay or inhibit them from working in the healthcare field. So it's really important that we talk about that. We get questions about this every year, and it's a really hard conversation to have with students. So it's imperative that they know they're going to be facing the criminal background check. They're going to have to do a drug screen, and our clinical partners, which is the hospitals, any healthcare agency, they require a set of immunizations. They require the flu shot, all the tetanus, all the MMRs, COVID vaccines, things like that have popped up over the years. So it's important that you know that coming into the program, that these requirements will be, this discussion will be had again with you sometime throughout the program, more so at the very beginning. And we can talk to you more about this later. If you have any questions, you can let us know about that. Thank you.
Hi everyone, my name is Lori Riggs, and I am the manager in the Center for Health Careers. And we are in the area of workforce and continuing education at the college in the area of health. Workforce and continuing education offers a unique opportunity to train for a specific occupation in a short amount of time. Our areas, we teach out of both Center and South Campus. We offer short-term certificate programs. And how are these unique? Well, they focus on specific skills that are necessary to get a job. They are in industry recognized certifications. So what does that mean? What that means is, for instance, nursing assistant. In order to work as a certified nursing assistant, you need to get that credential from the state. And in order to get that, you need to be trained within a program. And we offer that kind of a program. Another example of that would be phlebotomy. While you can become certified through American Medical Technologists as a phlebotomist after taking our program, it's not required to get a job out in the field, but the 100 draws that you will get in your internship is required to be a phlebotomist. So you can't just say, okay, I want to be a phlebotomist and go get hired off the street. You do need to have some training. We offer convenient class schedules. Many of our offerings are in the evening. We do have some weekend. In the fall semester, we offer a weekend nursing assistant program. And they are taught by expert faculty in their field. They are either professionals or they are currently still working in the field. So they have the expertise to teach the program and the classes. These are our programs that are listed on the screen. We have, many of our students ask, we have certified professional coder and certified medical reimbursement specialist. Those are split in the short-term training programs. We have been told by our advising committee that, you can work as a coder without being a biller, and you can work as a biller without being a coder. Now they'll cross over a little bit, but you can take those separately in short-term training and complete that. Also, in addition to these careers, we offer continuing education classes such as CPR classes that you can take and become certified in CPR. We have 1 semester programs and other programs that are a little longer. These are our 1 semester programs. Many of them include an internship. let's see, they're up to 16 weeks or in as little time as 10 weeks. And now I'd like to introduce Dr. Barbara Ellis to talk about our dental assisting.
Hello, everybody, and welcome. I am the Associate Dean of Dental Science, and I'm very proud to say that we have a 16-week non-credit dental assisting program that we have been running. We now have our second cohort of students going through, and they are at our clinic tonight in their 9th week of the actual program. The program itself consists of 4 courses that run the length of 16 weeks. A couple of them, one is a 12-week, that is dental materials, and one of the courses is an 8-week, and that is oral anatomy. The scope of the program is to give the students a comprehensive overview of dental assisting so that when the student is complete with the program, they can actually go out and get a job working as a dental assistant, a chairside dental assistant. They could be assisting a dentist, they could be assisting a dental hygienist, they could be working at the front desk of a dental office. What I will say about the program is it has had an enormous response from our area dentists who are in dire need of dental assistance. Right now, our career board, that is about a 5x8 bulletin board, is completely filled with job opportunities from dentists across the county. The program is run in the evening. It's held currently on Tuesday and Thursday evenings. It's what we consider a hybrid course. So the lecture courses are all online in our learning platform, Canvas. Those can be done really at the student's pace, but you really have to make sure that as a student that you keep up with your lectures on a weekly basis. On campus, and we're located at the corner of College Park and Martin, which is actually right across from the athletic fields at South Campus, we have our own standalone state-of-the-art clinic. It is absolutely gorgeous. I am just so excited that we have this facility. It is absolutely amazing. And as Associate Dean Shaw mentioned earlier, we have the latest, most innovative equipment that we can use in dentistry. And we keep up with our advisory board as to what exactly is being used out in practice and how we can best prepare our students for their employment. So we have a standalone building. All of the labs are held in our dental clinic. Now, one thing that I do want to add, in the associate degree program, you did see dental hygiene. Our dental hygiene program, I'm proud to say, is in the final stages of accreditation. That is through the Commission on Dental Accreditation. We had our site visit in January. It went fantastic. Now the report goes to the executive committee. They will review it in July, and then we are hoping that we will receive our letter in August. So the pending program, we are actually looking to have our first cohort of dental hygiene students in the fall, and that's this fall of 2022. Information is available for that program. And again, that's an associate degree program. It is selective admissions. So you can go on the selective admissions page. The web page is actually in the chat. For this one cohort, and I can't emphasize enough, it is only for this very first class coming through. All the materials have to be submitted by the student by July 20th. Okay, now any students who are planning on applying next year, we fall into the regular schedule of all the other selective admission programs. So it would be that February deadline. But for this first cohort, it's a little bit different because we're on a very tight schedule. We won't get our letter until mid-August, and we know that the semester generally starts the end of August. So we are going to have a very quick turnaround time for that. So I'm very, very excited, to have this offering. And it was based on community need and not just for the patients, because we have a running clinic. Students do have practicums and they are held in our clinic. State of the art clinic. We're going to have 20 patients being treated at a time by our students. We're going to have dentists on faculty, and our dental assistants work in there as well. So our students will be seeing patients, and we will be there providing preventative treatment to community members. We also are answering the call from the profession of dentistry. There is a very high need for registered dental hygienists and dental assistants as well. So we're meeting the need as far as the profession, and we're meeting the need of our community members. So it's going to be open to everybody that can come and get their preventative dental work done in our clinic. So thank you for joining us. If you have any other questions on that, feel free to reach out to the Dental Studies Department.
Okay, also we offer 2 semester programs in the short-term area, and these are 32 weeks or perhaps slightly less. So the pharmacy technician, as you can see, there is 16 weeks plus an internship. So that internship could take less than 16 weeks so that you could get that done sooner. The pharmacy technician is also required, the program is required in order to test to go out and get your certification from the state to work as a pharmacy technician now. Our certified professional coder and our certified medical reimbursement specialist both say that they have 5 courses within them. That is correct if you take one of them. However, if you take 2, you would be able to waive 2 of the classes because the prerequisite classes for both of those programs are the same. So if you wanted to take both of them, you would be doing 8 courses rather than 10. Things to consider when we're talking about continuing education or workforce and continuing education. You can get this certificate, go out and work in the field, and then continue on your pathway. We are not suggesting that this is the end of the road. It could be if that's what you decide, but you can also come back. Nursing assistant is a great segue into nursing. That way, do I like working with people or do I not like working with people and caregiving? Some of our courses equate to the credit side, one of those being medical terminology. You take medical terminology for one of our programs and decide to further your education on the credit side of Macomb. They will count the medical terminology that you took through our area of the college. Now, many of our programs, actually none of our programs qualify for federal financial aid. And that is because they're not part of a 2-year degree. However, there is more and more funding becoming available. Michigan Works will fund our program. We also have a grant opportunity through the college, and it is called a Second Chance Grant. And you can apply for that by filling out the Student Options for Success form indicating Second Chance Grant and your program of study that you're interested in. Additionally, there is a new grant that's for technical jobs training grant offered through Macomb County. It is available to specific programs. Dental assisting is one, laboratory assistant, phlebotomy, nursing assistant, and we're attempting to pull pharmacy technician into that as well. You can go to the macomb.edu and then type in the search box tuition assistance, and you can fill out a form saying that you're interested, and the department will contact you once you fill out that interest. Also, registration for continuing education does not require an application to the college. You simply go to the website, register, make payment, and you're in the class. However, I will, as Associate Dean Shaw talked about the criminal background check and the drug screen, that is also applies in short-term training. Anytime you're going out into an internship or to a clinical setting, those partners require that, and so our programs require that as well. We offer free information workshops, and those 2 workshops that are available. Dental assisting has a workshop that is available, and the other programs in the health career area, you can get to that and register at wce.macomb.edu. That's where you're going to go to register for any of the classes through workforce and continuing education. These workshops are informational. They're offered in different formats. I believe the dental assisting is remote, so you'll be virtual, but you'll be at a specified time. We offer the workshop, the health careers workshop currently is virtual through our learning management system of Canvas. And we're going to be holding an on-ground, our first in 2 years, workshop in April 5th. So we will be on ground if you prefer to come and hear about our programs that way. Thank you for joining us, and that's my portion. I don't know if there's any questions.
Okay, great. That was some great information on every program. We appreciate you being with us today and sharing that with us. I'm gonna quickly just go back into the chat. And one of the questions are the classes virtual or on campus? If maybe each of you could chime in and let us know for your programs.
I can go ahead. Dental assisting is hybrid, so that is the non-credit side. It is a hybrid, meaning that you are on campus in our dental clinic on Tuesday and Thursday evenings. Your lectures are online. Dental hygiene, you will be on campus in our clinic 5 days a week.
I'll go briefly. I've got a few programs. I've got nursing. Well, I'll start with nursing. Nursing is going to be a blend. So primarily, all nursing lectures, I would say 90% of them will be on ground in the fall. There are, all of our clinicals will be live at the clinical site. It's in the hospital setting. And there are labs that we hold on campus. We have the high fidelity simulation. Those will all be live as well on ground. So I would say 98% of the program will be on ground. My surge tech program and the CPD is all on ground. The respiratory therapy is all on ground. And the vet tech program will be all on ground, live. You might have a couple, incidental lectures or things that might be, sent over virtually to you, but for the most part, it's going to be live face-to-face.
For my programs, for my OTA, PTA, those classes are basically all back on ground now, with being so patient focused, and you need to have that touch and contact to be able to complete those competencies. So most of those courses are all back on campus face-to-face. Our medical assisting program does have some virtual courses, but for those competency-based classes, the students do have to come on campus for those in a face-to-face manner. Our early childhood is a blend of virtual and face-to-face. My health information technology program is mostly virtual. And then our wellness, health, and exercise science, we do have some virtual options, but all of those, of course, that include exercise components and those type of competencies are done face-to-face in our fitness centers.
Programs in the short-term area are, so our nursing assistant is a hybrid. So right now it is remote, and then the lab and clinical are of course on site or on ground. Our pharmacy technician is also a blend of virtual and in the lab. The coding program and the billing program both right now are virtual 100%. Our laboratory assistant for the summer semester will be on ground for the entire program. And I think that's it.
Okay. One question that we get asked a lot in the admissions area is, I do know that some of the programs, there are some prerequisites that you have to take before applying to the program. And the biggest question we get asked is, can we take that in the fall and the winter? But since your deadline for like nursing is February, if you could just expand on that of when they should take those classes, like consider taking those maybe in high school or in the summer if they're offered, to complete that to get for that February deadline. Can you just expand on that a little bit for me, Andrea, maybe?
Yes, sir. I was just thinking that. Yeah, so you can take them. They are offered over the spring, summer. A lot of the courses are in the spring, summer. Some of them are even more in a condensed form, like your A&P. It's kind of, you know, you're kind of there 4 or 5 days a week. But if it is a prereq, yes, you can take it in the fall. If outside of Barb's, Dr. Ellis's program, as long as you get if you can get it done in the fall before the application deadline of February 1st, that is amazing. If it's a prerequisite for ranking, if it's not a prereq for ranking, if it's something like a humanities or an English course that this needs to be done a requisite, the programs, most of the curriculum is designed, we have suggestions for when the students, it might be a later semester, or they might, okay, this would be a good semester for you to squeeze in a humanities class, or this may be a good semester for you to squeeze in an English. Mind you, not all the programs run year round. So for nursing, for example, it's fall, winter, fall, winter. They have the summer off in between the semesters, so they can catch up on some of their courses during that as well. So we have kind of a couple secrets for each program, if that helps. It just depends if it's a prereq or a co-req.
Okay, so if we have a high school student that might be interested in going into those programs, it's important for them to maybe apply early on and start getting their steps done and getting that recommendation from one of our counselors.
Absolutely.
Mm-hmm.
Definitely. The counselors are very instrumental to us in our programs. The advisors can spend a little more time with them, and they kind of get to know the student a little bit better, and they might know if they're working or what challenges, maybe some financial challenges that are going on in the student's life. So that all plays into the recipe of success for that student. So we really do rely on counseling and advising for that. So thank you for that, Terry. Yes.
Great. We do have another question here. With the health programs, are you able to move on with an associate's degree, or would they need to earn a bachelor's degree?
And I can speak for dental hygiene. Dental hygiene is a 2-year associate's degree. You graduate with an associate's degree in applied science. The students actually take their board exams at the end of their final semester. So when they are deemed sophomores, and they are ready, once they pass those exams, they are ready to go out into the workforce. There are dental hygiene students, and I was one of them, who do continue on with their education. And we are working on transfer agreements to such schools as Ferris State, University of Michigan, Wayne State. Any of the colleges that we can transfer from Macomb, we are looking to them for transfer opportunities. So there are many out there that we are already putting in the works for the dental hygiene program. So students can go on, they could get their bachelor's degree in dental hygiene. They could get it in another healthcare area, like public health is a big one, public health education. Some go on to get their degrees in education so that they can actually come back and teach in dental hygiene programs, which I strongly recommend if dental hygienists, feel that call to education, because quite frankly, our educators are starting to age out in our dental hygiene profession, because once they get into a program, they stay there. Because it is very enjoyable. It is just a wonderful career. So for dental hygiene, absolutely. The dental assisting program, which is non-credit, that you immediately go out into the workforce. After working for 2 years, you can actually sit down for your certification in dental assisting through our program. You just have to build up your working hours, and you can that's a ladder. You could step up, you can go and get that certification. And by all means, I will say, I know many dental assistants who have gone through dental assisting programs such as ours, and then continue on to dental hygiene. So they expand in that very same profession. So they have the title of dental assistant as well as registered dental hygienist.
Okay, great. Did anyone else want to add in, or want me to move on to the next question?
I could really quickly with my nursing. Obviously, it's an associate's degree. Associate degree nurses are high in demand and can do well with the associate degree nurse degree, just stopping there. However, we do have several affiliations with bachelor's programs, and with Macomb, a lot of online, and some of them are concurrent, which they can start the bachelor's program while they're taking in the ADN program, or some of them are completion, and they can do that upon graduation. So either one, and then they can go on to master's. And I'm a nurse myself, and I've run the gamut. I started with a bachelor's degree, went after my master's, and have taught, and now I'm an associate dean. So there's a million different things you can do with the nursing career. Surgical area, primarily, it starts with the sterile technician program, and then you can do the sterile processing, and then the surgical tech. They're pretty much it on there. However, many of them do go back and get bachelor's or master's degrees, like Dr. Ellis said, so they can teach. In the respiratory program is associate's degree, and you can go on. Actually, we are in the works of an affiliation with Ferris State right now, and I think Western, to do a bachelor's program in respiratory therapy with them. So there's always a higher level. We keep our eye on the mark. Is it a program, and we advise students all the time, is it a program that is worth their time and money? Where do they want to go with their lives? So there might always be something there for them. It just depends on where they want to go with it. So we try to keep them aligned with what their career focus is.
Okay, great. We do have another question here. What kind of classes would you be taking for the vet tech program? So I think there's quite a few. If they just kind of want some ideas.
Sure. Well, I started typing, so you'll save me some fingerprints on the keyboard. The vet tech program is an array of small animal. They kind of break it up from small and large animals. So small animal is your gerbil, hamsters, mice, rats, that type of thing, anything under the size of the screen type of thing. And then large animals. So they'll go and do cats, dogs. Cats and dogs are still considered small animal, and they do large animal. They teach about cows and horses and all the farm animal stuff. So there's classes and labs with those. There's also classes with clinical pathology. So you were learning hands-on skills as far as drawing blood, taking vital signs, doing surgery, anesthesia, spaying and neutering, doing dental work. We have a dental area on campus that they can do dental extractions, cleaning. So they learn gas, they learn blood gases, they learn how to sedate, how to recover them. And then they also learn how to do nail clipping, just the grooming type of thing. So they're, and then how once they do draw the blood, they learn how to look under the microscope. So there's a clinical component to it, a science portion of it. So it covers the whole gamut. Once they're done with that, they get tested and certified for a licensed vet technician. And that is what the veterinarians hire, and that's what they need. They do need lab assistants as well, but the LVTs is the certification program right now we have, and they're hot. They're in much demand. Hopefully that answers your question with the classes.
Okay, we have another question here. How many students are selected for the physical therapy assistant program?
Yes, I answered that one in the chat as well. We take 26 to 32 students. It depends on clinical availability, and also if we have any students that are returning back to the program who have stepped out for personal reasons.
Okay, great. All right. Well, you guys, you answered the questions very detailed, and I think that helped our students a lot. We're going to do a quick little summary here, but I want to make sure everyone has the opportunity to either take a picture of the contact information. Oftentimes we may think of a question later on tonight or tomorrow, and please reach out to anyone if you have any questions. So we'll be happy to answer that. We'll also have an email going out to you, everyone who attended today, and we will give you some information and also some more contact information. We also have a scholarship and bookstore drawing. So please check your email. There is a $50 bookstore gift card that you may receive. So we will be sending out that email to you if you are a winner in that. And also for every Discover Macomb event that a student attends, if you've had attended any in the past, we were giving you one entry into a drawing. So somebody may win a $500 Macomb scholarship, and that will be held on March 7th. So the winner will also be notified by email. We do have some upcoming admissions and outreach events. Again, we wanted to remind you of this. There's a registration QR code if you'd like to take a picture of that. There's also a registration link if you want to follow that and just register for these events. We'll send you some email reminders, but take a look at some of these options. And if there's anything that you think you'd be interested in, please register for these. There's some great information in these events. And again, we'd like to thank you tonight for being with us. We hope that we were able to answer all of your questions. If not, feel free to please reach out to us, and we'll be happy to answer anything that you might need. And you have some great supporters in our health field. So again, thank you for being with us tonight, and I hope everyone has a great evening. Take care.